You are tired of being called skinny. You are tired of people asking if you are eating enough. You are tired of clothes that never fit right, tired of looking in the mirror and feeling like your body is working against you. And so you did what most people do. You searched online, you asked friends, you went to the pharmacy or the gym and bought whatever someone recommended. Maybe you bought cyproheptadine, that little tablet everyone says makes you eat more. Maybe someone gave you a steroid. Maybe you are drinking protein shakes 3 times a day. Maybe you are eating everything in sight and gaining nothing. And you're frustrated, of course, because nothing is working the way you expected. Now, today, I want to tell you what is actually happening, what the right approach looks like, and what some of the shortcuts being sold to you are quietly doing to your body. Because being overweight or being underweight is a real medical concern, and it deserves a real medical answer, not a pharmacy counter recommendation with no examination. Okay, real quick before we start, I checked my analytics, and as I've always done, and 98% of you are watching without subscribing. And of course, you know who you are. I would like to request and ask you, please hit that subscribe button, tap the bell, and drop a comment telling me what topic you want me to cover next. I read every single one of your comments. If you're done with that, perfect. Thank you so much. I'm Dr. Libeya Bethwell, your pharmacist, and this is one of those topics where the internet gives you a lot of advice and very little of it is medically grounded. So let's fix that and let's begin. First, let us establish something really, really important. Being underweight is not just a cosmetic issue. It is a genuine health concern with real medical consequences that most people never talk about. Being clinically underweight means your body does not have sufficient energy stores. It doesn't have sufficient muscle mass or fat reserves to support optimal function. And when that happens, the consequences are systemic. Now, weakened immune function could be one of the consequences, meaning you get sick more often and recover more slowly. Bone density loss could be another consequences, where increasing your risk of fractures. Hormonal disruption, especially in women. Periods can become irregular or stop entirely. We have anemia, we have fatigue, poor wound healing in severe cases, and organ damage to some extent. Now, for young women specifically, being significantly underweight affects fertility. For young men, it affects testosterone levels and muscle development. Now, this is not about appearance. This is about your body having what it needs to function. And because it is a medical problem, it deserves a medical approach, not just eating more carbohydrates. Now, before we talk about solutions, let us talk about why gaining weight is difficult for some people, because understanding the cause is everything. The most common reasons are the following. Number one is a naturally fast metabolism. Now, some people burn calories at significantly higher baseline rate than others. They eat and their body uses it immediately. There is very little left over to store as weight. Number two is an underlying medical condition. Now, this is the one most people miss. Hyperthyroidism, an overreactive thyroid, that is, dramatically increases your metabolic rate and makes weight gain almost impossible. Diabetes, malabsorption, conditions like celiac disease, where your gut cannot absorb nutrients properly even when you eat well. Chronic infections, inflammatory bowel conditions. So if you have been consistently underweight despite eating normally, please see a doctor before spending money on any supplement or medication. A thyroid test, a full blood count, and a blood glucose test are where you start. Another reason could be because of inadequate caloric intake. Now, many underweight people genuinely believe they eat a lot, but when you calculate the actual caloric content of their diet, it falls significantly short of what their body needs. Perception and reality are often very different. Another reason could be stress and poor sleep. Now, chronic stress elevates cortisol, which suppresses appetite and affects how the body stores energy. Poor sleep disrupts the hormones that regulate hunger and metabolism. You cannot out-eat a cortisol problem. You have to fix it. Now, here is the section that I feel most strongly about, because this is where people are getting hurt, and they're getting hurt quietly without realizing it. Now, across Africa, and specifically here in Kenya, two substances are being widely used for weight gain outside of any medical supervision. One is cyproheptadine. Now, cyproheptadine is an antihistamine with appetite stimulant effects, acting as a serotonin receptor antagonist at the appetite center of the hypothalamus. Hypothalamus is a part of the brain. In plain language, it blocks a signal in the brain that suppresses hunger. You feel hungrier, you eat more, you gain weight. Cyproheptadine is a generally well-tolerated medication that has utility in helping facilitate weight gain in patients drawn from underweight populations. So, is it safe? That could be a question you have. In the right patient, at the right dose, under medical supervision for a specific purpose, this product is safe. But here is what is happening instead. In a study of nearly 500 participants across Africa, 72.9% had used cyproheptadine as an appetite stimulant without a prescription. Females were 11 times more likely to use it than males. Over half had been using it daily for more than a year. They've been using it daily for over a year, over 12 months, without a prescription, without monitoring, without anyone checking what it is doing to their body. Now, more than a half of those same participants were combining cyproheptadine with dexamethasone, which is a potent corticosteroid, as a so-called gym tonic for rapid weight gain. And this combination is where things become genuinely dangerous, and I want you to pay attention. Now, dexamethasone is the next product. We've talked about cyproheptadine, now we talk about dexamethasone. Dexamethasone is a powerful steroid. It is used in hospitals to treat severe inflammation, allergic reactions, and serious respiratory conditions. It is a prescription-only drug for very good reasons. Now, common side effects of corticosteroids include fluid retention, electrolyte imbalances, weight gain, increased appetite, nausea, and truncal obesity, which is fat accumulating specifically around the abdomen and face while limbs remain thin. Now, the weight you gain from dexamethasone is not muscle. It is not healthy fat distribution. It is fluid retention and steroid-induced fat redistribution. You may look heavier, but your health has deteriorated instead. Long-term corticosteroid use causes adrenal suppression, meaning your body stops producing its own natural steroids. It causes bone loss, ironically, making the very bones you are trying to strengthen more fragile. It causes elevated blood sugar, pushing people toward diabetes. It suppresses the immune system. Now, this abuse is notably high among young individuals, particularly gym goers who treat these drugs as a gym tonic, and cases of dependence and withdrawal symptoms are well documented. Now, dependence on a steroid bought from a pharmacy without a prescription to gain weight. This is the reality of what is happening, and it is one that I cannot stay silent about as your pharmacist. Now, what genuinely works? You could be asking yourself that question. What genuinely works? Here is your evidence-based framework that you can follow. We have what you call caloric surplus, which is the right way of doing things. Caloric surplus. Now, to gain weight, you need to consistently consume more calories than you burn. For most underweight people, this means adding 300 to 500 extra calories per day above your maintenance level. Now, the key word is consistently, not occasionally, not for 1 week, every single day, over weeks and months. Focus on calorie-dense, nutrient-rich foods like avocados, nuts and nut butter, whole eggs, full-fat dairy, oily fish, legumes, whole grains. These foods give you calories and the nutrients your body needs to actually use those calories productively. Second set of strategy is protein, the building block. Now, weight gain without adequate protein means you are gaining fat, not muscle. Every meal should contain a quality protein source. It should contain either eggs, fish, chicken, beef, beans, lentils, milk. Now, aim for roughly 1.5 to 2 grams of protein per kilogram of your body weight daily. Another strategy is resistance training. Now, exercise, specifically strength training, is non-negotiable for healthy weight gain. Without it, the extra calories you consume go predominantly to fat storage. With it, they go to building muscle mass, which is dense, healthy, and metabolically active. You do not need a gym membership. Bodyweight exercises like squats, push-ups, lunges, planks, done consistently at home 3 to 4 times per week will initiate muscle building. Another strategy is sleep and stress management. 7 to 9 hours of sleep every night. Stress management, whatever form that takes for you, because cortisol is the enemy of weight gain for underweight people. Manage it and do so really well. And finally, if you are not gaining despite doing all of this, please see a doctor. Get your thyroid checked, get your blood glucose checked, get a full blood count, rule out the medical causes before spending more money on products that cannot fix what they have not diagnosed. Let me leave you with this. Your body is not broken because it is thin, but it does deserve to be understood medically, not just cosmetically. Okay, the right approach to weight gain is not a tablet from the chemist that was designed for allergies. It is not a steroid that your body will become dependent on. It is not a protein shake with 47 ingredients you cannot pronounce. It is a caloric surplus, quality protein, resistance training, adequate sleep, stress management, and if you are not gaining despite all of that, a proper medical evaluation. That approach is slower than a pill. It is less dramatic than a gym tonic, but it builds a body that is actually healthy, not just heavier. Share this with someone who has been struggling to gain weight the right way and drop a comment below. Tell me what methods you have tried. I want to know. And if you haven't subscribed, please subscribe to this channel, tap the bell. I'll see you in the next video. I'm Dr. Libeya Bethwell, your pharmacist.